Hello, my name is Eddie Antonio, and today I'm going to show you how to explain to a patient how to use an MDI. So first off, I'm going to look at the patient's chart, and I'm going to verify the physician's order for an MDI. So it says here that it's verified. So first thing I'm going to do is I'm going to wash my hands 15 to 20 seconds in the sink, or use a hand sanitizer. And rub my hands dry for 15 to 20 seconds until your hands completely dry from the hand sanitizer. Okay. Alright, so the next thing I'm going to do, I'm going to put some gloves on. And then I'm going to enter the patient's room. Knock, knock. Hello, my name is Eddie Antonio.
How are you doing?
I'm a student respiratory therapist from Hartnell College.
Nice to meet you.
All right. Can you tell me your birth date and then your birth date and then your name?
Sure, my name is Cardenas, March 3rd, 1986.
Okay. Check. Awesome. You are Mr. Cardenas. So today I'm going to show you how to do an MDI, use an MDI.
Okay.
So first, can I have you sit on the edge of the bed for me, please?
Sure.
First thing I'm going to do is I'm going to check their lung sounds. So I'm going to check your lung sound first, okay, Mr. Cardenas?
Thank you.
And I'm going to go from bottom to top, all right? So can you scoot forward a little bit for me? Can you breathe in? Breathe in, inhale in and then breathe out your mouth, all right? When I say breathe. 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 All right, Mr. Cardenas, I'm going to do your front side, okay? So, over here. And then breathe. 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 Alright, Mr. Cardenas. Your lung sounds good. And next, I'm going to take your O2 saturation, which is the amount of oxygen that's in your blood, okay? So we turn this on. And just put your finger in there. And at the same time, I'm going to record your blood, your pulse. Okay? So your bar, it says here, your O2 sat is 97%. That's within range. And then for 15 seconds, I took your pulse and it came out to 21, and I will multiply that by 4. So your pulse rate would be 84 beats per minute. And your respiration, I counted 4 in 15 seconds. Now multiply that by 4, so your respiration is 16 per minute, okay? So here, we're gonna do your peak flow now.
Okay.
So you said how old are you, Mr. Cardenas?
I'm 30.
You're 30 years old. And then your height, sir?
6'1".
You're 6'1". Okay, it says here that your peak flow has to reach at least 622. So I'm gonna bring it up here. Okay. And what I want you to do is take a big breath in and then blow out as hard as you can, and you will do that for 3 times, okay? Alright. So you want 650 for the first one. Alright, one more time. Alright, 670. Alright, 650. You have some great lungs, Mr. Cardenas. So what we have here is your meter dose inhaler. Okay. So since this is brand new, the first thing you want to do is get the canister, which has your medication inside, and you would warm it up with your hands. Okay. So you do this, and what this does is it will warm it up, and then it will shake up the medicine, so it won't be just deposited in one area. Okay. Next thing you would do is you would insert it into the canister, and you would give it a couple shakes to just make that medication more propellant. Okay. And then you would give it 2 puffs, so it'll get rid of like the trapped residue that's in there. Okay, Mr. Cardenas. And now this right here is your spacer. What this does is, when you actuate the medicine, the MDI, it'll trap the medicine in there, and then instead of the medication from backing up in your lungs, more of it will go in, instead of it backing up into your throat, the more of it will go into your lungs, okay, and deposit in there, okay? So more of the medication will go into your lungs instead of your stomach or your systemic system. Okay, so one thing you're gonna do, first thing you're gonna do is this will insert onto here, onto the end of your MDI, and when you actuate it, make sure it's straight. You have face forward, press it, and do a slow deep breath, and hold it for 5 to 10 seconds, and then slowly breathe out. And you would do it twice for every treatment, and you would wait 1 minute in intervals before you take the next one, okay? So can you explain to me what I just told you?
Sure. Okay. So here we have my inhaler. This is the canister. To start it off, if it's a first time use, I would move the canister, and to actually activate the medication, the propellant inside, you rub it between your hands just to warm it up. This warms the canister, the medication, the propellant. Once that's done, I would place this back to my canister, to the device here, and then shake it up 4 times, right? Once that's done, I would actually give out 2 puffs. This is make sure that if this is a brand new one, to do that, and then just prime the actual inhaler there. So I do that, stand it upright twice. So that it's good. Okay. At this point, if I want to use this, I can actually do this. I have this device, the spacer. So I would take this and I insert it in here. Once this is in here, remove the cap, and I can actually press in here the medication, 1 puff. Medication will hold in here, breathe out, and slowly breathe in. And I would hold it for 5 to 10 seconds, correct?
Yes.
Okay.
Okay, and can you show me how you do it? Can you actuate that for me?
Sure. So medication's in here. I'm just gonna actually press it. Center, breathe out. Come in here. Alright, good job, Mr. Cardenas. Thank you.
Alright, so I'm gonna check your vitals one more time before I leave, alright?
Okay.
So first off, I'm gonna put the pulse ox again. While that's going on, I'm gonna just take your vitals, your pulse one more time. says here your O2 saturation went up. It was 97, now it's 98%. And then your pulse also went up a little bit, but not too much. It was before it was 84, I believe, and then now it went up to 86. And then your respiration was about 4, and then I multiplied by 4, so it's 16 respirations per minute. Okay. And now I'm gonna also take your nose real quick, one more time. Same thing as before. Let me see. Okay. From bottom to top. Ready? 1, 2, 3. On the front side. And we're going to check your peak flow one more time, alright? So it's still set to your age and your height. So same thing, take a deep breath in and a big breath out, okay? 3 times. Alright, 600. Job experience. Alright, 625. One more time, we gotta pass 622. Job experience, 650. Alright, and then there was an increase in your expiratory flow, about 20%. So that means that medication is working, okay? So now what I'm going to do is I'm going to record and report what I just did to Mr. Gardenius, to the doctor, or put it in his chart, and I'll take my gloves off, wash my hands with sanitizer, or if you have a sink, wash your hands there too, 15 to 20 seconds. Okay, Mr. Gardenius, I'm going to record and report what I just did with you, and I hope you have a good day, and I would exit the patient's room.